So one of the other main topics they were talking about at South by Southwest in the medical track was longevity and living longer, but also how to reverse different disease processes that are a normal part of aging. I'm not really interested in living longer, but I am interested in the part about, there are some diseases or conditions that can occur as a normal process of aging, like arthritis. And so they were looking at, different supplements, or they were talking about studies about different supplements that could potentially reverse that. And so one of them was resveratrol. And so I was looking at the studies for that as well. Now, you may have heard of resveratrol. It's been around for a long time. It's basically naturally occurring in red grapes. So it's, also in red grape wine and red grape juice and things like that. And so it is something that's been studied a lot over the years. So there are a lot of promising animal studies that showed in animals, resveratrol, usually in like mice or rats, had a lot of positive benefits in cell aging, cell dysfunction for different types of cancer, Alzheimer's, arthritis, eye diseases, dental disease, anything that really goes with the process of aging normally. But the studies in humans have been mixed. So some of the studies show positive changes, some of the studies don't. They show basically nothing happens. And there's a really small percentage of studies when I was looking that show that it may actually harm you, but that's seems to be less than 5% of the studies. The majority either show it could help or it doesn't do anything. And so if you're thinking about taking it, definitely discuss it with your doctor first, because there are a lot of medication interactions with resveratrol, but for the most part, it seems like it could help or it could do nothing. But if you, have specific reasons or disease processes or conditions you're concerned about as far as aging goes, sometimes people have family histories of certain things that they're concerned about. That would be definitely something to discuss with your doctor. An important thing to note is resveratrol interacts with the enzyme CYP450, and so that a lot of medications can potentially interact with it, blood thinners. So you should definitely look at it with your pharmacist or your primary care provider to see if you're on anything that could interact with it before trying it. And that would give you major side effects. And, it's important to note there are still a lot of ongoing studies because of the fact that there have been a lot of positive animal studies, but it's kind of been mixed in humans. There's still a lot of studies ongoing because, the results were so good in animals that if, some of those results could be reproduced in humans, that would be really good to know which disease processes or conditions it could help with that would, sort of reverse those conditions that are a natural part of aging. And that again is like not necessarily, it could be to live longer, but it could also be things like, glaucoma, arthritis, Alzheimer's, different types of cancers. Possibly it could help with those things. And so that's why there's a lot of studies, but so far the results are mixed. And the reason you would be looking at taking resveratrol as a supplement as opposed to just eating a lot of red grapes is because the dosing in the animal studies was very high. And so you wouldn't be able to eat that many red grapes in a day or red wine or anything like that. It was a much higher